Hi, everyone. This is E. David Crawford, Editor-in-Chief of Grand Rounds in Urology. Saw Palmetto is one of the most utilized over-the-counter preparations to impact BPH, perhaps alter the incidence of prostate cancer and inflammation. Joining us today to discuss this in detail are two of our Next Generation Learning Center editors. The first is Dr. Mark Moyad, who will be doing the interview. Dr. Moyad is Director of the Complementary and Alternative Medicine at the University of Michigan, has been in the field for over 25 years and is internationally recognized. The speaker is Dr. Curtis Nickel. Curtis is a Canada Research Chair in Urologic Pain, Inflammation, and Professor of Urology at Queen's University in Kingston, Ontario. I think you'll find this discussion to be very thorough, interesting, and I don't think you're going to find anything like this out there to deal and delve into all the information about Saw Palmetto. So Mark, take it away. Thank you guys for doing this.
Welcome to this special interview of Grand Rounds in Urology. I'm Mark Moyad. I actually am the Jenkins Book Kempner Director of Preventive and Alternative Medicine Education in the Department of Urology at the University of Michigan. And I'm with a good friend. And actually, it was handpicked today because I thought if I'm going to do a series of special interviews in the area of supplements and lifestyle, who would I pick? And there's only a small list in the area of complementary and alternative medicine. So at the top of my list, I can't tell you if he's gold, silver, bronze, but he's definitely at the top of my list, is Dr. Curtis Nickel from Queen's University in Kingston, Ontario. And if you haven't heard of him, there's even no reason to give his bio in terms of over 500 publications. His name is aligned with prostatitis. He's on the board or actually peer reviews for 8 different urology-based journals, past president of the Canadian Urologic Association. I mean, I could do this for 5 minutes on your CV, Curtis, but welcome to this interview, and I really appreciate your time.
Thanks, Mark. It's a pleasure to be here.
Great. And what I want to do, I told Dr. Nickel on the phone that I wanted to sort of surprise him with the supplement. And the supplement, what I decided to title this interview today, I call it, "Oh, Saw Palmetto, where did you go and where are you going?" And the reason I did that is I found it very interesting historically, since I've known you for several decades, that you remember back in the 1990s and 2000, Saw Palmetto was everywhere. The discussion was everywhere. There were meta-analysis saying, hey, this thing works, it's outstanding. Can you just reflect back on the history of the hype? There was just an incredible hype. Did you feel it like I did there in Canada and all the excitement on Saw Palmetto?
Well, Mark, to be truthful, that excitement that you describe about Saw Palmetto is still present in the overall world scene, except in North America. So what you're describing is what we're feeling in North America, but the excitement and enthusiasm for Saw Palmetto as a supplement therapy or even as a primary therapy for various diseases, including benign prostatic hyperplasia, is still there.
Wow, that's interesting that you say that. So let's go through why in North America, maybe the enthusiasm is a little less, and then we'll finish up with why the excitement in Europe and other places seems to be at a very high level. So I remember in 2000 going through the reviews, and then there was this talk of doing 2, and I call them, we don't call them in supplements phase 3 trials, which is sort of a shame because in drug trials, when you do a phase 3 trial, you feel like that means it's a definitive trial. Methodologically, it's very high quality. So the first one that comes along is this, before the one that you were authored on, was the STEP trial, and that was by Bent et al. And it published, I think, in 2006. Can you tell us a little bit about that and what they find? And if you have any comment on the STEP trial itself, STEP trial?
Yes. Well, you're absolutely right. There are 2 words that can be used to describe why our perception of the value of Saw Palmetto in North America. And one of them is STEP and the other is CAMUS, which we'll likely come along to. STEP was the first clinical trial. It was not a phase 3 trial, but it was a very well done randomized placebo-controlled trial with what appeared to be a reasonable CO2 extracted Saw Palmetto or Serrano repens extract. It appeared also to be powered to show a difference in clinical symptoms in men suffering from moderate BPH. The numbers weren't the numbers we usually see in a BPH trial, but and in a small trial, compared to other BPH trials, when we look at pharmaceuticals, the results were negative. There was no efficacy shown for this particular Saw Palmetto, which, by the way, I believe is not available anymore worldwide. It basically was a negative trial, and that put a bit of a damper on plans for a much larger and a study that we were working on designing, the CAMUS trial.
Yeah, so let me, so the STEP trial was negative. This is 2006. People are a little bit down on Saw Palmetto. It didn't work any better than placebo. And even when they looked at secondary endpoints, if I remember, there just wasn't anything there. Now, in all fairness, it was as safe as placebo, which is important because we really didn't have a handle on what possible adverse effects could happen. So I did this for the audience. So this is the STEP trial, which is the first sort of rigorous North American trial. And then this comes along and you're one of the main authors on this. And can you tell us just the setup and the history behind the setup of how are you doing this when you now know that this is negative, but you're about to do this major trial? And I mean, I would call this phase 3 like trial that you were a part of. And so if you can give us a little bit of the history of the setup, because I know there was some controversy as to what products should be included. Should it be Saw Palmetto only? Should it be other products? Should it be drug products? Can you give us a little bit of that history going into this trial?
Right. So that particular trial put together an enthusiastic group of researchers. For the most part, we believed that Saw Palmetto or Serrano repens extracts and perhaps, other complementary medical phytotherapeutic agents with or without that would show benefit in reducing the symptoms of BPH. And this was based on multiple studies done in Europe and elsewhere with other brands such as Permixon. At the time, there were over 40 publications, about half of them in the non-English literature, attesting to Saw Palmetto's potential efficacy and safety. And we were designing this trial and powering it based on those studies. About when we were to start, they released the STEP data. We were going to use the STEP data to adjust how we designed our trial, what we call the power, how many patients would be required in each group to show a benefit. Well, STEP came along and we couldn't power it because they didn't show any benefit. So we would need thousands of patients in each arm to show a minute difference if we saw the same thing as STEP. So the funders said, no, you either have to cancel the trial because the die is cast and we already know the answer, or you have to change the design. So we stopped what we were doing and put together a different clinical trial in which our outcome would be to stop progression of BPH events. And we're also going to do a stepwise dosing strategy to see if we could find an optimal dose that was still within safe limits. So we designed the study, would go on a year and a half. Hundreds of men would be enrolled in this study. And the men that were in the Saw Palmetto arm would receive gradually increasing doses. So at the end of the study, if they tolerated it, they would be receiving 3 times the dose that we would usually give. And the outcomes were not only reduction in symptoms, but reduction in progression of symptoms. Well, the CAMUS trial was also, in most respects, negative when we compared it to the very identical looking and smelling placebo.
Yeah, so I think you said 2 things that for people who are very conspiratorial, I just want to let them into my little world. And what I mean by that is, you said, as you set up this phase 3-like trial, we believed there was something there. And then the other thing you said is the funders. So correct me if I'm wrong, this was government funding, correct?
Correct.
Okay, so you had government funding. This wasn't funded by some company on a mass scale that said that you're going to do it this way. There wasn't that sort of influence. And most of the researchers, including yourself, I know this, you had faith that something is there. So you didn't have a group of researchers trying to disprove that Saw Palmetto works. They were actually somewhat Saw Palmetto fans. And then you had independent funding, right? So both of those, am I correct? Okay,
Correct.
and that's important for the audience to know. And then in 2011, in September, you're one of the authors there. It comes out in the Journal of the American Medical Association, and it says, regardless of the dose, low, medium, or high, it doesn't work any better than placebo. Now that went 18 months, 72 weeks. So do you have any comment on that? It was a different type of Saw Palmetto, but did you see any hints of efficacy or anything that wish you had a couple $1 million after the trial to further study something that you saw in that study?
Well, I kept up with the literature at the time, and I keep up with the literature now, and I still believe that we missed something very, very important in that clinical trial. So the last years, the decade has been trying to figure out why 2 clinical trials out of almost 25 or 30 randomized placebo-controlled trials were negative, where all the others were positive. Why were those 2 trials negative? And what they did is they turned the perception of North American physicians and urologists against the recommendation of Saw Palmetto. So what basically happened is Saw Palmetto went underground, and it became sort of a primary patient-driven and industry-driven, to some extent, treatment, where men, in my practice, many of them, whether or not it's the efficacy of the Saw Palmetto or a little placebo effect or a little bit of wishing it would work, patients did well. And I had many patients who stayed off medical therapy, stayed away from surgery, and were happy with this. And I continue to suggest or recommend Saw Palmetto extract as an adjunct for men who are on a My Watchful Waiting program. In other words, men whose symptoms are not severe enough, or men who want to stay off medications and are looking for alternative approaches. And that's based on the overall world literature that we've been able to review. Now, Mark, what's really interesting is the difference in concept and perception of how Saw Palmetto works with physicians in North America versus the rest of the world. And we can see that in prescribing patterns, in recommendation patterns, in usage patterns, but also in guidelines. The recommendations or not for the use of Saw Palmetto, when we compare, for instance, the very prestigious American Urologic Association guidelines to urologists on how to treat BPH, and the equally prestigious and well-researched guidelines that the Europeans use for the same purpose, they're exactly opposite when it comes to the recommendation in regard to Saw Palmetto.
That's incredible. And we're going to get into that for just to end the last part of the interview, but can we go back on the CAMUS trial that you did? Is it true or false, since you were on the inside and I'm on the outside looking in on that trial? There was discussion, and I've read about this in some previous publications on the trial, that the trial was going to look a little bit different. They were thinking about using also another herbal product, Pygeum africanum, for example. There was discussion of using an alpha blocker. There was a discussion of using something else besides a placebo to go up against Saw Palmetto. Is that true, and why didn't it happen?
Right. One of the problems we had was ethical sourcing of the products that we were going to use. And we could not find any ethical sourcing for the other complementary products. In that, and we thought we found one in Madagascar for Pygium africanum, until we actually, somebody actually was out there on vacation and saw how they were stripping the trees and killing them from the producer we were going to use, very respectable. And we could not find somebody that was harvesting this that we ethically felt we wanted to propagate as a therapy. It basically would just kill all the trees in Africa if we used that particular, and it worked. That's sort of behind the scenes. We had similar problems with Saw Palmetto. One of our major problems with Saw Palmetto is we had a big hurricane at the time, wiped out the Saw Palmetto fields in Georgia and North Florida, and we had to source it differently. And then it was difficult because of all the different ways it's extracted and the different ways that people pick the berries, the type of ripeness, the type of fatty acid concentration. So we knew we wanted a lipidosterolic extraction methodology that would extract a USP grade, medical grade of Saw Palmetto with over 80% fatty acids. And there's really only 3 types of ways you can do that: ethanolic extraction, CO2 extraction, and a hexane extraction. The best extraction technique is the hexane extraction. It does absolutely the best job in getting the quality that we wanted, except it's not allowed by the FDA because of the possibility of hexane remnants being left in the product, and that's sort of a carcinogenic and causes all sorts of other problems. So we're left with either CO2 or ethanolic extraction methodology.
And CO2 was the one that was used in STEP, and ethanolic was one that was used in the CAMUS CAMUS trial that you were involved in, right?
Yes.
But I wanted to stop you there for a sec, because the backstory, I didn't even know, and I've known you all this time, the backstory of Pygium. I didn't realize you were looking for a source, and when you found one, you were sort of aghast at what was happening, because on paper, that's what we see, that there's a lot of controversy with Pygium in terms of the sourcing. And if it comes from wild sources, it's endangered in some parts of the world. There's an environmental issue. And so that has become a new issue. So I didn't realize that back then you were dealing with that issue. That's really unbelievable. And then the hurricane, the backstory on your trial is fascinating. But to go to what you said about the excitement in Europe and other places, let's face it, there's one product, and the name is Permixon. That's a hexane extract, Permixon. And that probably has more positive studies. And do you just want to comment on Permixon? Have you seen it? Have you used it? I hear that it's a prescription in other countries. So it's a Saw Palmetto prescription. It's not, you can't just walk to the grocery store and buy Saw Palmetto like you can in North America or the United States. Isn't that true? Don't urologists have to write for it?
That's true. But let's backtrack a bit and look at what we've got in Canada and the United States. It's a wild west out there. A consumer has no idea, based on packaging, testimonials, and advertising, what's actually in the product. There's actually only one Saw Palmetto in the United States that has even gone for USP quality assessment. Most of the others have never been assessed. Many of them are coming now, unfortunately, from China, where when we assess them in our laboratories, there's not the concentration of fatty acids that we would even be realistically believe that it would be of any good. Some of them look like they've just had the berries and leaves boiled, and the extract has nothing in it, yet it's packaged as Saw Palmetto.
Wow.
There's almost no regulations. It's very much consumer beware in North America. In Europe, where Permixon is the primary major marketer, they extract theirs and they have quality control such that not only would it have met USP in North America quality, it achieves all the European Union limits that are required to have it be qualified as a medicinal product. We know many of the complementary medicine things that we're using in the past, ASA or aspirin for pain, digitalis for heart disease. They were all plant-based, and then we eventually, including antibiotics, were all come from nature. So they've all been upgraded to medicinal grade products. Well, in Europe, that has happened, and Permixon, using a hexane extraction, achieves fatty acid concentrations. And what's even more important to me is not just fatty acids, but it's a fingerprint of fatty acids. So it's like 9 different important fatty acids that are at the quality that, or the dosage in the pill that will achieve efficacy. But then it goes even, Mark, one step further. Those fatty acids have to be taken orally. They have to be absorbed. Then they have to be absorbed in the cell itself, the prostate cell. And we have to see at least 10, 20, or even better, higher percentage of those fatty acids being absorbed intracellularly. Believe it or not, there is most of this stuff that we get in North America, that doesn't happen. Not only do we not see fatty acids, we don't see a fatty acid fingerprint that is going to give us what we want to see. They're not absorbed properly, and they don't get in the cell to achieve anything. So that's why there's a little bit of a damper in North America, where in Europe, this particularly one that you mentioned, the Permixon, has undergone multiple, very well-run, randomized, placebo-controlled studies with multiple investigators, multiple funders in many different countries, and they all came to a positive findings of improvement in BPH, lower urinary tract symptoms in men. And when you look at the meta-analyses, it confirms that. Now, were the benefits achieved as high as medical therapy? Overall, in the meta-analyses, no. But in a number of trials that went head-to-head with alpha blockers, or a 5-alpha reductase inhibitor such as finasteride, in those particular studies, it was almost hard to believe, but Permixon did as well as the medical therapy. And based on that, the European Union, equivalent of the USP and FDA, has upgraded Permixon to a medicinal product which needs to be prescribed by a physician.
So everything that you're telling me, see, I went back through all the meta-analyses. In fact, the BJU positive meta-analysis just from a few years ago, endorsement from all these places of Permixon type Saw Palmetto. But basically what it sounds like, correct me if I'm wrong, it sounds like you are still a fan of Saw Palmetto as long as you understand what the heck you're getting, right? You still utilize it for watchful waiting patients. And let me just do a precursor here. People think of watchful waiting as it comes to prostate cancer. They don't realize there's a lot of patients who have BPH that also undergo watchful waiting. They're monitored. It's still monitored aggressively, but in terms of what you're taking is very light. You're not necessarily going on a lot of therapies, and you're still saying that you use Saw Palmetto for those watchful waiting BPH patients. Is that true?
That's absolutely true.
So then what product do you use? I'm not saying I don't want you to mention a name. Is it only a product that you analyze in your lab that fulfills a certain criteria for fatty acids and sterols? Correct.
And the reason why I can't mention that is I'm now a consultant for that particular company. But there is one company that provides Saw Palmetto, and the only company that is USP approved. They've looked at the fatty acid concentration and the fingerprint. Now, this particular company makes Saw Palmetto not only their own product, but they sell it to many other reputable pharmaceutical companies and health food stores, which can incorporate that, which they do incorporate that into their product.
Okay, so now you have me a little bit dumbfounded. So someone's going to watch this and go, okay, Dr. Nickel, how do I find that product at my local store in Toronto or Detroit or Philadelphia? So is there a certain buzzword I'm looking for?
Yes, it's actually easier than you think. So instead of looking just for a Saw Palmetto concentration or Saw Palmetto dose, like 160 milligrams What you want to do is look at whether or not it actually has the fatty acid concentrations. Some of them will even give you the multiple fatty acids that are available and the concentrations. And it may say that this is the Saw Palmetto that's incorporated in that company's product is USP approved. Then you know that's the product that will work.
Well, you mentioned something that's very important for our audience, that USP it's a third-party group that overlooks and looks at quality control independently of the company. It looks at quality control of the product and then reports on quality control. And what people don't understand, at least in the United States, when I talk to physicians, healthcare professionals, if you talk to consumers, patients, is that there's all this talk of quality control, you know, NSF, USP, even QL, but very few herbals get tested under quality control. It's always the easy stuff, in my opinion. Vitamin C, well, okay, you can tell me my vitamin C is vitamin C or my vitamin D has an adequate amount of vitamin D. But when you get to herbals, I use the saying all the time in teaching, herbals are a different animal, meaning you really need the quality control when it comes to herbals, but it's so hard to find a single quality control label on many herbals, right?
Correct. The other thing is and if you can, and basically you have to do your own research by finding the company you buy off of, whether it's Costco, Walmart, or a health food store, and find out where they source the Saw Palmetto extract. And if they don't say it, and like I said, 90% of the American Saw Palmetto is coming from China right now. If I was going to set up a Saw Palmetto pill and market it, I'd buy it from China because it's a fraction of the cost of getting the real stuff that's made in America.
So were you saying that when the average consumer watches this video, they need to ask for the source, and the source should be from Florida? It should be from the southeastern United States, or was that one of the places you should target? And then
unfortunately, yes, because you're not going to be able to source the Permixon because of the FDA rules regarding hexane extraction and the fact that Permixon has to be prescribed in the first place. So you're not going to be able to get that particular product, which I believe is likely safe. The Europeans feel it's safe, but it doesn't pass the muster of the North American Health Canada and FDA. So if you're going to do it, if you're going to use a product like this, you're going to pay a little bit extra money because you're going to get a Saw Palmetto extract that is grown in the United States, in Georgia or North Florida, and that is made and manufactured in North America, and it has gone through quality control with a North American respected quality control assessor.
Wow. And then your final tip on Saw Palmetto, what's the percentage of fatty acids and sterols I'm looking for? Okay, so now I find out that it comes from Northern Florida or Georgia. I find out that USP, it's verified by a third-party group. So now I've checked both of Dr. Nichols' box. The third box I got to check is the key phrase I'm looking for in terms of the content. What's the key phrase again?
Where most of them won't have that on the packaging or the insert, you want to be able to find that it has over 80% fatty acid concentration.
Wow. I mean, look at all this. I've gone back with an expert back and forth now in this category on this subject in 20 minutes and learned more. And I think the audience learned more in 20 minutes than you could have learned by reading 6 million pages of different books out there. So I didn't know what you would say during this interview. I would have thought you had said Saw Palmetto is not working any better than placebo. You were part of that trial. I understand you're a consultant, but I know you well, and you seem very excited still about if you get a good quality control product, you can utilize it. Are you utilizing it with some prescriptions, or are these standalones in the watchful waiting patients who have BPH?
Right. So in Canada, as in the United States, Saw Palmetto or Serrano-Repens extracts are not prescriptions. And you know, the way I recommend it and feel it's ethical is that all the studies, including the ones that I did, the product is safe, absolutely safe, with almost no downsides. And everyone in the trial, including those on placebo, had benefit. So if my patients, are looking for an alternative to medical or surgical therapy for their BPH, or they want to stop the progression. They think it's getting worse over time, and they like to stop that progression. Then I suggest they look into Saw Palmetto as an alternative. And I tell them that is not as good as the medical therapies or the surgical therapies. It may not work for them, but I truly believe it's safe, and they will find out whether or not it's doing them any good within 2 or 3 months. And
Yeah.
then it's their decision, as they're their own best healthcare advocate, of whether they want to go with what they believe and perceive as a natural product rather than one of the pharmaceutical products that I would next recommend to them.
Do you ever get scared combining a high quality, third-party company verified product from the South of the United States? Notice how I got in all 3 of your top criteria just in that sentence. Do you ever feel nervous about it if they take it with a 5-alpha reductase inhibitor or an alpha blocker or an OAB or one of these drugs that a lot of urologists use in terms of prescriptions? Do you feel nervous about the combination or not?
Not at all, except it would be a waste of money to have it, to use it with a 5-alpha reductase inhibitor, since one of the ways we believe Serrano-Repens works, and only one, is intracellular 5-alpha reductase inhibition. And we believe that's what actually stops the hyperplasia or increase in number of prostate cells that occur. Whether or not you actually get a reduction in size of prostate, I don't believe you really do, but you may retard or postpone the progression. But it also works through anti-inflammatory mechanisms. And we know that in BPH, it's the inflammation caused by the runaway hyperplasia of cells in a sort of a controlled manner compared to cancer, but you still get inflammation. And the degree of inflammation drives the symptoms. So if you stop the hyperplasia, the number of cells increasing, and you reduce the inflammation in the prostate gland, you may see the symptoms stop getting worse, and they may even get better.